Australia is looking to make urgent changes to ease pressure on COVID testing sites as infections surge. More than 18,000 new infections have been logged, and that is a new high. Prime Minister Scott Morrison has called an emergency meeting tomorrow. Danielle Robertson reports.
Frustration is spilling over in New South Wales and testing sites are being inundated. As the daily COVID case numbers almost double, there are long lines and wait times at these testing sites that are now gripping the state. PCR tests are now being prioritised for those who are showing symptoms, who tested positive on a rapid antigen test or who are a close contact. And that's to try and ease the pressure of healthcare staff, authorities saying that pathologists in particular are working overnight and they are exhausted as they try and get these tests back to get to people in a timely manner. Now, a lot of these people who are waiting in testing queues, the government says up to 30%, are getting the swab because they need it to travel. For example, at the moment, to enter Queensland, you must have a negative PCR test before you can enter the state. Now, Queensland is going to scrap that rule from January 1, and that means that Tasmania will become the only open state that will require a PCR test for travellers entering their state. Now, there are a lot of changes happening at the moment in New South Wales, in particular around testing, and New South Wales is saying they are no longer going to be able to give people their test results back within 72 hours. Some people reported not getting their test results for up to 8 days, which has really thrown people's travel plans into chaos. People have had to rearrange their flights and their hotels and accommodation over this travel period waiting for those test results. There are other changes happening too. New South Wales Health are no longer checking in on COVID positive patients personally, rather they are telling them that after 10 days they are allowed to leave isolation on their own accord. It's really a sign that the entire system here is overwhelmed and overworked. Now, tomorrow there is going to be an emergency national cabinet meeting that is going to be held, and there's going to be three main topics, and that's going to be tracing, isolation and testing. Now, up until this point, states and territories have led the way in terms of what rules they want to implement within their own region when it comes to COVID. But it looks like now there might be a national plan when it comes to defining things like close contacts and when it comes to what tests people should take and when. This meeting tomorrow is looking to consolidate a lot of the issues that the country is seeing, and there's also discussions that isolation times might be slashed from 10 days to just 3 days. This is now really all becoming part of living with COVID, particularly in New South Wales as cases continue to soar. All of these changes happening as Australia prepares to enter its third year of the pandemic. Danielle Robertson, CNA, Sydney.